All right, now let's discuss the impact of the strike on health provisions in the country. We are now joined via Zoom by Dr. Joe Phaahla, National Health Minister. Minister, a very good afternoon to you. Now, Minister, you went on record to say that this strike by NEHAWU has led to the loss of lives. Give us the latest on how the strike has affected healthcare facilities across the country.
Well, it's a mixed bag. Many provinces have been affected. Some not to a very huge extent, while others have really been very seriously affected. A province like Limpopo, very minimal, Western Cape, fairly minimum, some disruptions in Khayelitsha, but the rest of the province, not much. And then when you go to other provinces, Gauteng, quite a lot, very serious, disruptions. Also Eastern Cape and KwaZulu-Natal in some of the districts, and also in the Free State, as you have been showing, as from yesterday and also today. A number of districts in the Mpumalanga area have also been affected. So in some hospitals, there has been a situation where 95% of people have not turned up over the Monday, Tuesday. Some varied from day to day, but a number of provinces where the strike started on Monday, we've started to see a lot of improvement. As an example, in the Northwest, the Klerksdorp-Sepong complex in the Kenneth Counter district in the Klerksdorp-Matlosana local municipality. It was quite bad on, I think, Monday and Tuesday, but as of yesterday, there is a 95 to 100% operations at that hospital. As you would know, here in Gauteng as well, a number of hospitals were affected on Tuesday, Charlotte Maxeke, and then also in the Val, in the Sidibeng area, Sebokeng Hospital, Kopanong, and others in the Ekurhuleni, Telemogherane. So in many of those, there's now started to be serious improvement where more and more workers have started to come back. So that's really the situation overall, I would say. Overall, compared to Monday, the overall picture is a very significant improvement, except for areas like Mpumalanga, where the strike only started yesterday and is starting to seem to be picking up today.
Let's look at then, those effects, from Monday. I mean, our reporters have been across the country just reporting on how this has devastated patients particularly. Do you have a direct number of people and patients specifically that have been affected by the strike? You also mentioned that some people have unfortunately died.
We're still gathering information, but so far what we had received about deaths which could be linked with the strike, it's largely in the Gauteng province. As I've indicated previously, there has been some more numbers, and which, in the preliminary assessment is that they can be linked. We still have to get, our clinical teams are still providing more data. From the number which I had mentioned of 4, late yesterday I was informed that there were 2 more deaths. So just in Gauteng, we're looking at 6, which preliminarily we are linking with the strike. And we are saying preliminarily because once, people die in a hospital where 95% of the staff are not on duty, and a ward, for instance, where there would have been 20 nurses and other health professionals, and you only have 2, and is in a high care or a ICU situation, then until proven otherwise, you have to conclude that if those patients had been properly cared for with adequate staff, in some cases, patients, only had 1 meal or no meal at all for a 24-hour. Some cases until when we were able to move in emergency assistance for better part of the day, patients had not had treatment. So it's those kind of circumstances which But at the end, for conclusive, legally standing kind of assertion, you need to link the cause of death with the circumstances which are there. So that may take a few more days to conclude. But on the surface, preliminarily, I would say that we're looking at a number of 6. I have not got any further information from other provinces. But of course, over and above, that's the extreme situation. But other people, chronic, who must receive chronic medication, others who needed procedures, operations to be done, have had to be sent home. So the impact in terms of the inconvenience of pain and suffering is quite huge. The death is the extreme part, but a lot of pain and suffering.
That is concerning. And Minister, notwithstanding that, judgment on the court case to determine if this is in fact an illegal strike, let's talk now about the issue of security. Speak to us about the role the SAPS has played during this strike, which has in some quarters been criticized and described as lackluster. Tomorrow will be day 6. Have you beefed up security at hospitals, and will you also be bringing in some form of reinforcement in the form of the SANDF?
We had our reservations at some stage in some areas, and again, it varied from area to area. There are areas where the SAPS moved quickly and stopped people from obstructing those who wanted to come into the hospitals to work. There are some areas where the police were very reluctant, sometime even just watching. I mean, yesterday I was talking to a CEO of one of our hospitals in Soweto, and who was saying that when she came and there were barricades, her gate was barricaded and burning tires. The police station in that particular hospital is the neighbor to the hospital. She went to the neighbor, which is the police station, and asked for assistance. And they said, no, we're busy. Unfortunately, we won't be able to help you. See how you get into your hospital. And she had to navigate and finally end up being able to access, finding her own way to enter. Those are some of the bad examples. But overall, situation has been improving progressively, especially after the court orders. There were some who were still wanting to be convinced that the court order is, in fact, a legal enforcement. And so we found each other. And I've also been regularly engaging with the minister, and the DG has been engaging with the commissioner. So there's been improvement, and we've seen, in a number of areas, improvement. So I would say at this stage, I know a number of people, on different media have been asking, why are we not calling the army? I'm convinced, and together with the team, I met with the MECs last night virtually, and we don't think at this stage we're at that level from a security point of view. We are very thankful that the military health services have come to assist. When things were quite bad in the Tsepong, Klerksdorp area, the military health services sent medical personnel from the military, and there are a number of other MECs, Gauteng, one of the hospitals, they were looking at that. I'm discussing that with the Minister of Defense, and I've just seen another letter from one of the MECs, but it's more on the military health assistance, not on the security side. So that's where we're looking at when things are quite bad. But I'm hoping that with a general move towards more attendance, some hospitals which had maybe 10%, today when I get the report is 90%, workers being on duty. So it's promising that overall the situation is moving for the better.
It's good that it's promising, Minister, but, just as we close off the interview, I want to find out from you, because, of course, we know that some of these members are affiliated to the health sector, and they've had long-standing issues about, not only wages, but also how the areas in which they operate, they've long been complaining about under-resourced, resource in the facilities that you provide. Do you have sympathies, for these workers and their plight? I mean, they are asking and calling for a 10% wage increase, but the government is only offering 4.7% increase. When you look at the climate in which we are currently living, Minister, what is your take just on some of the plight of these workers, and also are you engaging your counterparts?
In terms of the issues themselves, I mean, I've no doubt that, a number of the issues which are being raised are genuine issues, but they've got a forum under which they are being discussed. The Public Service Bargaining Council is that forum, well established, and even if there are disagreements there are procedures. So I'm quite sympathetic to the issue of the livelihood, protection of income, because we've come from a very difficult situation of the COVID pandemic, where we have loaded the health workers in terms of how they've saved many lives, and that we wish that they could actually get even a better improved dispensation. But there are ways in which those are being addressed. What we have a problem with, it's just total disregard for even just human rights, where even if we've got a genuine matter, but when you then obstruct others from exercising their own rights, and even risking in a situation where lives can be lost, and obstructing those who are willing to come in, notwithstanding that they also have certain grievances, but who want to come in to save lives. If you now go to the extent of obstructing those and pulling people out of medical wards and casualty where they are providing service, that's totally unacceptable. I think that's what we will not agree with. But in terms of improvement of the conditions of service, including also the work conditions, equipment, and other working tools, that we agree with, and it's a matter which we're addressing together with other colleagues.
Minister Phaahla, thank you so much for your time this afternoon. Really do appreciate it. Dr. Joe Phaahla, there is Health Minister.
Thank you for the opportunity.
In the country, of course, the Minister saying that there are indications that show that 6 people in Gauteng may have died as a result of the strike, which started on Monday. Of course, these are preliminary findings, and we'll have more details, of course, as and when the Minister again briefs us.